Hi, my name is Ariel and we're here with Dr. Katzen. Welcome to another episode of DocTalk Beverly Hills. And today we're talking all about Morpheus8.
Morpheus8, yeah, wonderful machine. It's sort of a new machine, new advance, and it combines basically two technologies, microneedling and radiofrequency.
Mm-hmm. How does it work?
Yeah, it's pretty amazing. So microneedling goes in at a certain depth and it causes trauma, microtrauma, to the dermis. And once you have a area of the skin that is traumatized, it makes collagen to fix it. And then the collagen is slowly replaced over time, leading to tighter skin, less wrinkles, etc. So it combines that microneedling, but it goes a little bit deeper. Okay. And then it also uses this technology called radiofrequency, okay, which is sort of a frequency of energy, like you turn on the radio in your car, that's radio frequency. You're getting radio waves that are coming through. So what it does is it, one, penetrates the skin with the microneedles, and then it zaps the skin, that's what the radio frequency is, to contract. So the heat, the thermal energy from radio frequency causes the muscles just underneath the skin to contract. So one, you get the trauma from the needles, causing the collagen to be synthesized and contracting, and two, you get the stimulation from the heat from the radio frequency for further skin contracture. So it's a double-double. You get two things.
And people also sometimes use it for areas like the neck and the arms to tone, to defat slightly. How does that work?
So pretty much you can use the Morpheus8 on all body parts. You know, we're not going to use it on the eyeball, but, you know, on all skin parts is what I'm talking about. So people commonly use it on the face, but we can use it on the neck and the tummy and the inner thighs and the arms and the calves, pretty much the entire body. Now, we don't do the entire body in one setting because we need to get these areas numb before we do the procedure. And you can't numb up the entire body because that's too much cream at one time, too much lidocaine cream. So typically we'll separate these areas out. Typically we'll do like maybe the face and another body part, or two maybe body parts, maybe tummy and thighs. Just depends on the patient.
So this is to help tone, but it's also important that, you know, it's not like going to get the same results as a tummy tuck, for example.
Correct. Again, it's this sort of the spectrum of patients. You know, do you need a full-blown facelift with SMAS surgery? No. You need a little bit less. Do you need a mini facelift? No. Do you need like chemical peel? No. You just need a little tightening up. So that's where the Morpheus8 comes in. Okay. Or sometimes after a procedure like liposuction to further tighten the skin, we'll use the Morpheus8 at the same time to help that skin to maximally contract.
And we've been looking at a lot of before and afters of these Morpheus procedures. Specifically, I've been looking at a lot of the face ones. And it seems to get rid of a lot of fine lines, wrinkles, minimizes the look of pores. What else does it do? Yeah,
so basically it, because of the depth the needle goes in, it also helps to kill some of the fat. So the needle actually traumatizes the fat. There's scar tissue that's formed in the fat. The fat is strangulated and dies away. So you also get some liquidation of the, or liquefaction of the fat. Fat goes away.
Which is why some people look a little more contoured after.
Correct. And you get a little bruising. That's some of the trauma from the micropen. And then later on, that bruising that you get maybe 3 to 4 to 6 weeks after the procedure, that can actually be some of the fat that's dying off.
Oh, that's interesting. Okay. Yeah. That's cool. I did one round of the Morpheus8. I did it on my face and on my neck, and it wasn't so painful. So they numbed us up beforehand for about 40 minutes to an hour. And then I know that there are different settings. Like, for example, certain areas you go 2 millimeters, and then in certain areas you go as deep as 4 sometimes.
Correct.
With different energy frequency levels.
So as you feel around your face, there'll be thinner areas, typically like your forehead, your eyebrows, your orbital region in there. And that we go not as deep. And on the thicker areas, the cheeks, the jowls, sort of the jawline, will go at a deeper setting. And on the neck, depends on the neck, but typically we'll go at sort of an intermediate level. But again, before we do these procedures, we want to make sure the patient's comfortable and numb. So that's why these numbing creams are essential. And sometimes we give the patient Valium or sometimes even pain medication to help chill out. Another machine we use often is the Pronox machine right by your side there. It's laughing gas, and basically patients are very happy on that. But again, you can escalate it to the point of do we need to do it, and sometimes we do, in combination with liposuction or a facelift to get that further tightening of the skin.
Yeah, I would say that the pain is not so bad. It's like a little discomfort.
Scale of 1 to 10.
Probably a 2 for the most part. Certain areas could rise to like a 3 or a 4, but It was tolerable. I don't think I have a high pain tolerance, and I didn't need the Pronox machine or anything.
Good.
Also, I didn't want to use a Pronox machine in front of everyone that was here, so that would have been embarrassing.
Yeah, no, we would have found out all your darkest, deepest secrets.
Too late. They know everything. But it really wasn't so bad. The jawline, the bony areas, they do hurt a little more. But I already saw, like, some results. Like, I feel like my pores look smaller after just the first treatment. And we are doing 3 treatments, so it's probably only going to get better. We have a video up on YouTube to show just what it's like to get the Morpheus on the neck, so please check that out. If you guys have any questions, our PA Talia is also available to answer questions, and she's the one who performs a lot of these procedures, right?
Yep, she's very well trained and very skilled technician, wonderful lady, and highly suggest Talia. That's why she works for me.
Yeah, we love Talia here. So if you guys have any more questions about the Morpheus8, please give us a call at
310-859-7770.
All right, or you can DM us at Dr. Katzen MD on Instagram.
All right.
Thank you so much. Have a good day.
See you soon. Thanks.